Hi everybody, this is Michelle from Virtual Hand Care, and in this video I'm going to show you my top 5 exercises to increase your wrist ulnar deviation. So let's get started. Now do make sure that none of these exercises cause any kind of pain. You don't want to be pushing these too hard. Keep in mind when we're talking about ulnar deviation in the wrist, and also even radial deviation, just that whole combined radial and ulnar deviation in the wrist, we really don't have a ton of motion. The average person typically has about 30 to 35 degrees of ulnar deviation. So just keep that in mind when you are doing these exercises so that you don't overdo it. Okay, so exercise number 1, we're gonna start first with our forearm in supination. And I find that starting with supination when you're working on wrist mobility can be a little more comfortable for you because that has changed the relationship of the radius and ulna on the wrist, which can be more comfortable for you and therefore allow you to maybe move a little more. So what you do for this one is tuck your elbow at your side, turn your palm up, and then what you're going to do is you're going to just move that wrist into ulnar deviation. So it's going to be moved towards your body. Now if you can only do a little bit, that's okay. And if you find that you're moving the arm too much with that, then you want to use your other hand to isolate and lock that elbow at your side and also hold that forearm so that you're not cheating. So let's do a couple of these together to warm up. So we're going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. So exercise number 2, this one is more of a passive stretch. Now you are going to need a TheraBand or maybe something that you can actually stick your arm on and keep it from sliding around. And I'll show you what I mean by that. You're going to want to prop yourself up on a table or a yoga block. And I'm actually going to lay the TheraBand over the top of my block here. And I really like TheraBand because it provides traction. And the reason for this is because we're actually going to use the TheraBand to try to help give our forearm and our skin a little bit of movement, a little bit of mobility, massage, as we try to stretch into ulnar deviation. So go ahead and prop your arm up. You can turn your arm this way, whichever is more comfortable for you. I'm going to just turn it this way so that you can see what I'm doing. We're just setting the arm down on the TheraBand, and then we're gonna just start moving the arm. We're not sliding the arm over the TheraBand. We're letting the stickiness of the TheraBand kind of pull that skin and try to loosen that skin up. Now this is really helpful if any of you have had any kind of surgeries that might be feeling like the skin or the scar is kind of sticking a little bit, and that's what's preventing you from getting that ulnar deviation. And just kind of even do a little rocking side to side. And as you can see, my skin is moving quite a bit. Now yours may not be looking like this. You can even do this up into the ulna and up into the hand as well. And you want to just kind of feel everything kind of moving around and making sure everything is kind of gliding and sliding nicely. Do that for a few minutes here. And then what you want to do is you want to then pull the elbow back. And as you can see, the skin has kind of moved up, right here. So what we're doing is we're trying to give a little bit more space up here. And then we want to take our other hand and we're going to relax the fingers. And then you want to slowly stretch the wrist down into ulnar deviation, keeping some of that skin. We want to see if you get a little bit of wrinkles when you're doing that. Now that can be hard for you to see because it is on the other side. And you can move around if you need that wrist off of the table because maybe it's a little uncomfortable if you have it too high up. You can have it down here, anywhere that's comfortable for you. And so you want to hold that to a count of 10, making sure the fingers are nice and relaxed. Ready? 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then relax. And you would want to do that about 3 to 5 times. I wouldn't do too many of those because that can kind of aggravate it a little bit if you push it too far. Okay, so exercise number 3, you're gonna need that band again. This one, we're gonna work on stretching over a longer length of time. So this is helpful for somebody that maybe this one was a little uncomfortable for you. You could try this next exercise. It's also helpful for somebody that has had stiffness in ulnar deviation for quite some time and they've tried a bunch of different things and it just still doesn't seem like it's coming along. So it could mean that the tissue needs to stretch out a little bit longer over a longer length of time. So if you've watched any of my other videos, I do often teach about low load, long stretches. And that means that you're simply stretching the tissue out for a longer length of time, and low load means that it's not very painful and it's not very aggressive. It allows the tissue to be a little comfortable and slowly stretch out over time. So to do this one, again, you're gonna prop your arm up on a table, pillow, or yoga block. With the TheraBand, I like to make a little bit of a knot so that you can put the knot over your hand. And then just relax your fingers. You don't want your fingers straight for this one. You want them nice and relaxed. If you feel like you want to put a washcloth or something in your hand to hold, you can do that too. So you want to relax fingers, relax the wrist, and your other hand is going to pull down into ulnar deviation. So with this one, we have more of a pulling effect going into ulnar deviation versus the last one, we were kind of coming more on top and trying to push down. Sometimes this way can be a little more comfortable because the line of pull is a little different. You want to hold this for a while. Now, when I say a while, I mean, a minute, 2 minutes, 3 minutes. You can even do 5 minutes or a little bit longer. Now, if that's hurting your other hand, then you can use your foot to step on the TheraBand and let that just slowly stretch the wrist down, and that's a little more comfortable, letting the TheraBand do the work and slowly stretch your wrist down. Now keep in mind too though that you might have to play around with what feels comfortable as far as the angle or the line of pull with the band. The best way to get the most accurate stretch is to have the line of pull more perpendicular to your wrist here. So if this is your access point, we want kind of that line of pull to be more like this. Now, if you're up here and you don't have much ulnar deviation, then your line of pull would just be straight down. However, as you improve and you get a little more wrist range of motion, you would want your line of pull to be more this way. And so you can simply change that line of pull just by applying a little bit of pressure on that band. And again, you would stay here for a couple of minutes just to stretch that out. And then you would slowly release, because especially if you've been there for a few minutes, this can be a little uncomfortable for you. So you may want to take a break. Okay, so exercise number 4. This one is going to require you to grab a lightweight, maybe grab a can in your pantry, something that has a little bit of weight to it, not too much. If you're just starting out, probably just a pound or 2 would be fine. However, if you feel like you can do a heavier weight, then go ahead and do that. However, we do want to think more of quality versus repetitions or how much weight that we're lifting. So when we do ulnar deviation, the main muscles that work on ulnar deviation are Flexor, Carpi, Ulnaris, which is on this side of the wrist, and then our Extensor, Carpi, Ulnaris, which is this tendon right here. See how it pops up when I move my hand into some ulnar deviation. Exercise number 4 is going to have 3 parts to it. First, we want to work on the flexor carpi ulnaris. So to do that, you want to grab your weight and again, prop up on a towel or a table, hang your wrist off of the edge of the table if you want. Palm is up, and we're actually going to work on bringing the wrist up into wrist flexion. So what we're doing is we're just going to do some wrist strengthening exercises first for the flexor carpi ulnaris. Now, this is not the only muscle that flexes our wrist here. We're also working on the FCR, which is the flexor carpi radialis, but we're trying to warm up that FCU. So we're gonna go up and down 10 times. And then what we're gonna do is we're gonna turn the palm down. Now we're gonna go up into wrist extension. And so again, we're going to be using that extensor carpi ulnaris, that ECU. Now again, that's not the only muscle that works on just wrist extension, but it does assist with wrist extension, and so we're trying to warm it up this way. So again, up and down, and then really making sure when you go up that you're trying to bring that wrist all the way straight up in a good alignment here. And we're gonna do 10 of these as well. Now we're gonna really isolate just the FCU and the ECU by doing ulnar deviation. So we're gonna bring your arm at your side, and then you're gonna have elbow straight. Other arm is gonna help hold the forearm and the humerus by your side, relaxing the shoulders. And then we're gonna work on bringing the wrist into some ulnar deviation. And we're gonna do about 10 of these, making sure that you're not moving the whole arm, right? We're only isolating the wrist, and we're just moving in ulnar deviation with that weight. And relax. Okay, so exercise number 5. This one is gonna work more on all kinds of combined movements in the wrist and also into the forearm. This is a little more advanced, so it's gonna work on a little bit of that overall wrist and forearm coordination. So I've made myself a Jux-A-Cisor. They have these on Amazon. You can find these online. They're a little more professional looking online, and I'll put a link below of where you can find something like this, but they can be a little expensive, so I went ahead and made my own. I had a hanger handy and some washers, and I went ahead and put a little piece of tape. You can wrap a washcloth or something around the base so you have more of a grip to hang on to. The point of this kind of exercise or game, if you want to call it that, is to get the washers from one side of the hanger to the other side of the hanger. But you have to make sure that you really are just using forearm and wrist range of motion. You're not cheating, and there's quite a few ways that you can cheat with this. So first, let me show you how to do this, and then I'll kind of show you what I often see people do when they're cheating because they have some limited range of motion. Okay, so you want to stick your arm at your side, and the point again is to try to get the washers to the other side of the hanger. What I'm doing is I'm moving my wrist and I'm moving my forearm. Now I got those washers on the other side. Now let's do that again. Now, if you have your own hanger, that one's a little harder. There we go. See how much wrist and forearm range of motion I need and how much wrist ulnar deviation I need to do this? You can make this as hard or as easy as you want. You can put all kinds of bends in the hanger. The one online also has quite a few little bends, and it's also wider, so it really does require you to move that forearm and that wrist a little bit more. But it can be a fun way to work on, oops, I got one stuck, It can be a fun way to work on your range of motion. Without even really thinking that you're working on your range of motion. So a few things I see people do to compensate or to do this is they move their arm around kind of like this. And so then they're getting a little too much shoulder and not enough wrist into there. So as you can see here, this is all kind of mostly shoulder if I'm letting that elbow stick away from my body. So tuck that elbow in, get that elbow stuck in at your side, and work on doing that exercise to get the washers down. And another way I see people try to do this when they have limited wrist range of motion is they try to move this in their hand. So they try to kind of take their fingers and move the wire around in their hand, or they kind of do this little like kind of catching thing and twisting and any way to try to get the washers to the other side. I've seen it. Just make sure when you're doing that exercise that you get the arm tucked at your side and you're truly only working on that wrist and forearm range of motion, but also have fun with it. So if you find that you're having a lot of wrist pain when you're working on ulnar deviation, it may mean you need a little bit of stability, a little bit of external support while you're working on your mobility. And I really like the bullseye brace for that. So it's a simple little brace that you put on, and then you can work on all of these exercises that I showed you, and it doesn't limit your mobility. What it does is it just helps keep that wrist and that ulna in a little bit of a better position, which can really help reduce the pain when you're working on these exercises. I have another video where I talk a little more about the bullseye brace that I'll link here, and I'll also put a link below of where you can find this. Let me know in the comments below if this video helped you. If you found this video helpful, do please give it a like, and also don't forget to hit that subscribe button below. And don't forget to check out these videos here that YouTube is suggesting for you. Thanks for watching.